Okay, good afternoon. Thank you all for being here today. I'm pleased to be joined by City of Rochester Mayor Lovely Warren, Wade Norwood, the CEO of Common Ground Health, Monroe County Public Health Commissioner, Dr. Michael Mendoza, Dr. Michael Apostolakis, the Chief Medical Officer at Strong Memorial and Highland Hospitals, and Dr. Robert Mayo, the Chief Medical Officer at Rochester Regional Health. Since the moment COVID-19 first appeared in our community, we have seen countless people coming forward, stepping up, and raising their hands to help. People are volunteering to fill food boxes, make face coverings, distribute educational materials, and address any other needs that arise during the crisis. Our community has come together to face this challenge. It's what we do, and it's what we will continue to do as a community. Because as we look to find out what our new normal will be, we all have a role to play, which is what today's announcement is all about. I have said all along, we are blessed to have two incredible health systems that have continually stepped up to meet our community's needs during this crisis. When they were called upon to address the threat of a potential surge in patients, they collaborated and they innovated to protect this community. And now that challenge in front of us is to maintain the progress that we've made in flattening the curve and stopping the spread. To ensure that we can begin to reopen safely, they have stepped up once again. In collaboration with the University of Rochester Medical Center, Rochester Regional Health, Common Ground Health, the City of Rochester, and the County of Monroe, I'm excited to announce the launch of the WROC COVID Symptom Tracker, and I'm asking all of you to sign up today. This groundbreaking daily health screening tool will be a frontline defense in the fight to prevent the further spread of COVID-19 in Monroe County and across the Finger Lakes region. The data collected will not only help increase the understanding of the virus and measure effects to slow its progression, but will also help determine where to focus testing and how to adjust stay-at-home and physical distancing requirements. The concept is quite simple. Residents across our region can volunteer to go online and answer a short question about how you are feeling each day. Very soon, we'll be rolling out a text version residents will be able to access on their phones to provide that same information. The information collected will go into a database and will be used to help detect potential hotspots of the virus early, while symptoms are just starting to develop, which will allow quicker action. Rather than waiting for lagging indicators like the hospitalization rate to increase, we'll have a close eye on early warning signs that will help us maintain the health of our community and protect ourselves, our families, and our neighbors. This new tool is a game changer. But here's the thing. It will only work if a critical mass of people in Monroe County and throughout the region sign up and actively participate. It's a unique and critical opportunity each and every one of us has to look out for one another and ensure that we're doing our part to keep this community safe and healthy. Signing up is easy, and you can do so by visiting roccovid.org. Again, it's roccovid.org. It's a secure and confidential website on which you'll fill out a very short survey consisting of just a few questions. First, you'll be asked if you are experiencing any symptoms, such as a fever, cough, chills, or any other primary coronavirus symptoms, followed by basic demographic information, including your zip code, age, gender, and ethnicity. You will not be asked for your name, address, or any other identifying information. You will have the option to provide an email address if you'd like to receive daily reminders to take the survey. And that's it. You won't be asked to share any detailed health information or identifying characteristics, and the data you provide won't be used for any other purpose. The information collected will be used to aggregate symptoms in the community by zip code so that health professionals can see in real time the health of our community. It's no secret that these past 2 months have been hard. We faced uncertainty, made sacrifices, and experienced hardships that were unimaginable just a few months ago. But we have also come together, built partnerships, and stood up in the face of unprecedented challenge in ways that show how strong we are as a community. And today, with this announcement, it gives me hope for what comes next. I want to thank the leadership, researchers, and information technology staff at both the University of Rochester Medical Center and the Rochester Regional Health for working together to create this incredible, unique, and like I said, groundbreaking tool. I also want to thank our partners at Common Ground Health, a team that has always been an effective and trusted convener around public health challenges in our region and has now taken on that important responsibility to store, manage, and analyze the data that will be collected. I particularly like to note the contributions of Ann Dozier, Michael Hazelberg, and Dr. Mike Leonard, and Albert Blankley for their key contributions in the development of this tool and getting us to this important announcement today. And finally, I'd like to thank our partners, our partner counties throughout the Finger Lakes region, as well as the City of Rochester, for their collaboration and commitment to this project. Because if we're going to truly see an impact, this needs to reach every corner of our region. And it's going to take all of us working together in partnership to make this successful so we can see in real time the health of our community. So next I'm going to call on Mayor and welcome Mayor of the City of Rochester, lovely Warren, who's been a fantastic partner working through in a collaboration, working through the COVID-19 crisis to make sure that our community has all that it needs to serve our residents and make sure we get through this on the other side together. So Mayor Warren. Oh, Mayor Warren, I think you need to unmute. We have you on mute. Uh-oh.
There we go.
There we go. There we go.
Thank you, County Executive Bello, and we truly appreciate your leadership and your team's leadership during this time. We could not be where we are in this community without the great support that you and your team have been providing to our city as well as our towns during this time. I want to thank, of course, Dr. Mendoza and the team at the Monroe County Board of Health because they have been extraordinary with working with our partners in getting us the information and of course our health systems. We want to make sure that we continue to support you in what you're doing and appreciate this innovative idea that we have before us. We know that the best way to deal with the fear and uncertainty of the COVID-19 crisis is with the precise and accurate information. And that is exactly what the WROC COVID Daily Survey provides, a simple and easy way to share information about health via your phone or computer. This data will allow us to understand where the virus may be in our community and to quickly provide guidance to help us to make sure that we are responding to the needs of our community. But we need you to help us as well. That's why I hope you join us in going to rockcovid.org today to sign up and then to take the survey every day. As Dr. Mendoza will show us in a moment, it's quick, it's easy, and it will help our community recover together. I want to again thank all of our partners that have made this new tool in the fight against COVID-19 possible. Leading the charge has been County Executive Bello. I want to also recognize Wade Norwood from Common Ground Health and the entire teams of UR Medicine and Rochester Regional Health. And of course, again, our Public Health Commissioner. Most importantly, I want to thank you, the residents of our community, for stepping up and protecting your circle by going to rockcovid.org today and signing up to help us help you by taking the survey every day. We need you and you need us, and we need to get through this together. Thank you and God bless.
Thank you, Mayor Warren. And next, from Common Ground Health, we have CEO Wade Norwood. And he will talk about why taking this regional approach is so important and further explain Common Ground's role in this effort. So Wade Norwood.
Thank you, County Executive Bello, and thank you, Mayor Warren. Common Ground Health is delighted to partner on this effort with Monroe County and with the city, Rochester Regional Health, and the University of Rochester Medical Center, because as the regional health planning entity for the Finger Lakes region, Common Ground Health continues to aim to live up to our name. We have to build and sustain the common ground on which we all as a region can identify and address our community's health challenges. Throughout our history, the key to achieving health improvement has been collaboration. We continue to stand out in the nation as a collaborative community in the space of healthcare, and at no time has the task and the need to do so been more important than now. This WROC COVID community tracking tool has the potential to demonstrate an even deeper level of collaboration, because it is a task in which we all can and we all must participate, because it will provide the data that can bring focus to our region's efforts to pursue the path to recovery from the COVID-19 crisis. Building on our history as a trusted source of health and healthcare data in the region, Common Ground will securely house the data that's collected from the tracking tool and provide this data to help government and health leaders track potential coronavirus hotspots and identify potential at-risk populations. I'm confident that this tool will provide our region with the data that we need to successfully reopen our community and keep our economy as strong as it can be, while also keeping people as healthy as possible. But in order for this tool to work, I would just like to underscore the mayor's comments. We need participation from all the adults in our 13-county region. I'm asking people from all backgrounds and walks of life to join me in taking part in this daily survey. It really doesn't take a lot of time, but it is really important to have an opportunity every morning to just check in and understand how we are doing. And we need the engagement and involvement of everyone in our region, especially from those communities that have been traditionally medically underserved. African American communities, our Latino neighbors, and our regional rural neighbors as well. We also want people to encourage their coworkers, friends, and families to take part. I'll end my comments by acknowledging this is a stressful time. This is the first press conference I've ever done by Zoom. It's a measure of how much our lives have changed. And people are taking on a lot of new roles, from pandemic schooling their children, to working from home, to staying home to help keep others healthy. Everybody is doing incredible work in our community to slow the coronavirus spread and help us reach our new normal. No one's doing more incredible and more visible work than our own Dr. Mike Mendoza. And Mike, thank you for your efforts during this pandemic. But today we're asking everyone to find a way to lean forward and do one more thing, and that's take the survey. Help our community build the data that will lead to recovery, and help us, as the mayor would say, rock COVID. Thank you, County Executive Bello.
Thank you, Wade, and thank you again for all the work that you do at Common Ground Health to take this real regional approach to our health and safety here in the Finger Lakes area. So thank you, and thank you for your partnership on this project. We are now going to be joined by Monroe County Public Health Commissioner Dr. Michael Mendoza, who is going to show us how this tool works and explain in more detail why it is so critical that people sign up for WROC COVID and complete the survey each day.
Thank you, County Executive Bello, and thank you again for this opportunity to share such important information with our public here today. I also want to extend my gratitude to Mayor Lovely Warren for your outstanding partnership in the city and for ensuring that all communities within our county are represented on the survey, as well as to my colleague Wade Norwood, Dr. Michael Pastelakis, and Dr. Robert Mayo from our health systems, because your partnership has been invaluable in making this project come to fruition. This has been a week of great collaborations across our community. Tuesday, we learned about the collaboration between the University of Rochester and Rochester Regional Health to recruit study volunteers to participate in a vaccine development trial here, one of 4 sites across the nation. Yesterday, we learned about the collaboration between the county, city, and local towns and villages to bring over 1 million masks to residents all across the county. And today, we are announcing a tool that is unique in our region and our state, a tool that will help us to identify people who might be at risk for COVID-19 so that we can help to keep you healthy and so that we can help to take appropriate precautions as a community to ensure that we keep the curve flat and continue on the process of reopening our society. Before I demonstrate the process for using ROCCOVID.org, I want to take this opportunity to recognize Dr. Michael Hasselberg, Associate Professor in the Department of Psychiatry at the University of Rochester, and his team at the University of Rochester Health Lab, who's been working tirelessly for months to make this vision a reality. It's your vision that stands to make an immeasurable contribution to public health in our region. So with that, I'm going to share my screen here if I can and demonstrate this. All right, can everybody see my screen here? All right, so as you can see, this is the initial screen that you go to. The website here is ROCCOVID, ROCCOVID.org. And when you get to this landing screen, you'll see this image here, and we're working on providing this in Spanish as well. What we're gonna ask you to do to begin, when you first log in, is to click on this button here in the top right that says Start Daily Health Screening. So I'm going to do this as though I've never done this before. So this is the view that you will see if you're coming to this website for the first time. You click on Start Daily Health Screening. And here it explains a little bit about the process. It welcomes you to the tool. It explains briefly that you are to check in daily about how you're feeling, again, to give us a clearer picture about how you're doing on every day. It emphasizes that this is a voluntary process. If you've got additional questions about the use and privacy, there are links here to read about that. And then you just simply indicate that you're interested in participating and that you've agreed to these terms. So I'm going to click on that now. And then it asks you, would you like to share your email address? So here I'm going to make this so that I can see it. Let's go back here. I'll make this go away. Trying to get it so that you can see the whole screen. Apologize here. Can't see the bottom. There you go. So I'm going to hit yes there. There you go. And then I'm going to put in my email address. And then it asks you for your zip codes. So I'm going to enter a zip code here at the health department. And then as you can see here, the first question asks if you've had any of these symptoms. So temperature of 100 degrees or higher, a new cough, hard time breathing, sore throat that's not due to allergies, body aches, loss of taste or smell. If you were to answer no to this, you'd essentially be done. But for demonstration purposes, I'm just going to answer yes for today. And when you answer yes, it will say to select the symptoms that you have had from the list below. And so I'm going to click on this list and I'll say I've had a cough here. And then I'll hit send. And then it just wants you to confirm that you've had a cough, and I'm going to confirm. I'll just say yes for today. And then in this case, it'll ask you for your age, and it's just a range of ages. It's not going to be your exact age. So I will indicate my age here. And then gender here, you can answer male, female, non-binary, or prefer not to answer. So I'll answer male. And then you're welcome to enter your race ethnicity, which I think is important to enter if you're comfortable, because it allows us to dig into the details of various communities within our county. And so I think it's important for us to understand as best we can. So I'm going to answer what's true for myself. And there you go. So in this case, I only answered cough. And so that's generally not enough to cause concern, but you know, we are gathering the information, and depending on what you answer, you will get advice that's tailored to how you're feeling that day. But then when you're done, you hit close. And again, if I were to say I had none of these symptoms, the survey would have been over very quickly. And so again, that's it. We really want to invite everybody in this community to participate in the survey. This is only as good as the data that we get into it, and the more data we get, the better an understanding we're going to have of our community. So with that, I'm going to hand it back over to the county executive to close it off.
County
You need
executive,
to
you're on
unmute,
mute.
Adam.
You're on mute.
Really? That's the first time I've done that. Thank you, Dr. Mendoza, for showing us how that works. I signed up for it myself this morning, and I could tell you, as someone who's asymptomatic, when you put it through, it's one question and you're done. And so it's very quick and easy to do. So we're now going to open this up for questions from reporters. As a reminder to reporters, we also have Dr. Apostolakis and Dr. Mayo who've joined us here as well from the hospital systems, and so they may be able to answer any questions that you have for them as well about this new system. So, Julie?
All right, let's start with Brett Dahlberg from WXXI, and Steve Orr from the Democrat Chronicle is up next.
Hi all, thanks for taking this time with us. I have a question I think is probably best suited for Dr. Mendoza. I wonder about what changes, what actions do we take once we've found what we think is a hotspot? What does this enable us to do? And I also wonder about that because it sounds like the most detailed geographic data we're getting from this is at the zip code level, and many zip codes in the city are, 4, 5, 6 or more square miles. It just doesn't seem like it allows us to pinpoint all that much, but does it?
Well, Brett, it turns out that it does. This information is going to be very helpful, and certainly it's a balance between, our general goal of public health and balancing that certainly with people's right to privacy. And our goal here is not to identify individuals. And we believe that through modeling and other methods that we have in the health department, again, in collaboration with Common Ground Health, we will be able to get very important information even at the zip code level. We're looking for patterns, we're looking for trends, we're looking for things as they emerge. The whole idea here is to prevent and to predict, and not necessarily to look back and see, who's actually sick, because we'll know that already because of cases and hospitalizations and so forth. So this is really an attempt to look into the future by looking at what's happening literally every morning, every day here in our community. And so this has been, tested in other markets in the country. And so, we believe that this will put us on good footing in terms of identifying trends really early here in Monroe County.
And what about what it allows us to do? What actions do we take once we think we've pinpointed a hotspot?
Well, once we get the data from this, again, through the analytic component with Common Ground Health, it will allow us, potentially, depending on the situation and where we think the hotspot might be beginning, to do outreach, to educate, to test, to identify people who might be at risk, to see if there's potentially a congregate living setting that's in that zip code, or if we know that there's a group home in that zip code, or if there was an event in that zip code. I mean, those are the kinds of things that this will give us a clue for. But again, we're not trying to identify individuals with this. We're really trying to look at this sort of in broader strokes, because again, our goal is to identify trends early in a public health sense, not so much in a clinical sense.
Thanks very much.
Thank you, Brett. Steve Orr from the DNC is next, followed by Andrew Banas from 13 WHAM.
I guess one question, I don't mean to sound cynical, but why would somebody, especially who is healthy, fill this out? And what benefit is there from me telling you that I'm not showing any symptoms?
Well, Steve, it's important to know that you're well, because then we have a denominator to know how common it is of those who are unwell. oversampling in a particular population only tends to give us skewed statistics. And so in order to have an accurate picture of the population, the vast majority of us are going to be healthy, hopefully. And so that gives us a way to interpret the data of those who may be showing some symptoms. So I think it's very important for people who are well to indicate that, because again, that gives us a better understanding of what's going on.
Thank you. And if I could just ask as well, I believe Adam mentioned in the beginning that there will be a phone-based app or phone-based version of this coming soon. Can you tell us when and how that will work?
Sure. So what will happen is hopefully over the next couple of weeks, what we're planning to do is add a text message-based option to this. So again, it's optional, and if you want to give your phone number, a cell phone number that can receive text messages to the system, then instead of sending you an email daily to remind you to fill out your form, it'll actually send you a text message, and then you can just click on that text message link each day and answer your survey right on your smartphone. So it's just another really tool as a reminder, because I know, if you're like me, you see your text messages a lot quicker and respond to them quicker than you do your emails.
Thank you.
You're welcome.
All right, Andrew Banis from 13 WHAM and George Radney from Challenger Community News should be standing by.
Hey guys, good afternoon. Thanks for doing this. Wanted to ask, first of all, the information collected with this, the data, will this be made public, or if not, will you guys be releasing it periodically? Can people find more information after they've submitted it about different hotspots or what other neighboring communities are putting in for their answers?
Wade, do you want to take that, or do you want me to take that?
Mike, why don't you?
Okay. So, again, our intention here is public health. And so initially, on first blush, our plans are not to release the data, because I don't think that they're necessarily going to be useful in a public way. And again, there's going to be some limitations depending on how many people will respond and so forth. So certainly, though, the outcomes of what we're doing, we want to be very transparent about. But I think the raw data from who's got a cough and who's got a fever in the various zip code, I think that's not likely to be very, very useful in a general sense. But certainly the actions that we take, we're going to want to be very public about that.
Thank you. I also want to ask, can I ask an off topic here? I just have one health question, maybe from Dr. Mendoza or either health organizations.
Sure, Andrew, go ahead. Yep.
Okay. This is about, we know at Golisano there was a mysterious illness with a young patient that we just got some information on yesterday. Wondering if we could talk more about that, about what we're learning about that and where things stand in our community regarding that. Some information we can maybe give some concerned residents today.
Do one of the chief medical officers want to weigh in on that, or Dr. Mendoza?
We have one patient who's being referred to that's in our children's hospital that's under evaluation right now for inflammation related possibly to the coronavirus. And that's really all we can release at this time.
Okay. George Radney from Challenger Community News and Patty Singer from Minority Reporter, you're up next. George?
Yes. I'm hit the, yes, my question is to the group. How do we deal with the concerns of confidentiality? And also, number one, and two, how do your plans to go out and reach the African American Latino community, especially who definitely have grave concerns about confidentiality as well?
Mike, you want to take part one and I'll jump in for part two?
Well, so I'll take the first question about the confidentiality. In the health department, we take data very seriously, as you all know. I'm very, very careful about how we use data and how we share data, making every possible precaution to keep data private whenever it needs to be. These data are going to be housed at a server that Common Ground Health is supplying for us. They are no stranger to security. They have been a trusted source in this community. They've administered the large surveys that you've seen go by the last several years, and they are a trusted source of data security in our community. So I have no concerns whatsoever about our ability to keep these data private.
Aiden, I love you. And George, I would add to that I think that the value of Common Ground being the home of this is that it places the data in a community-based organization as opposed to in the hands of any particular employer or even in the hands of government. And I appreciate the fact that the mayor and the county executive would turn to us to play this role. That's been our history of really making available our ability to connect different data sets in a de-identified way to bring focus to regional health issues. I think your second question is incredibly important, which is how do we carry this message to communities that might not be predisposed to participate,
right,
to actually engage. And we have been in conversation already with our partners. The folks that the mayor has made available have been incredibly helpful to us in terms of thinking about the strategy to reach communities of color, to reach low-income populations, to think about how we engage with rural populations. This will not be rich and robust and meaningful for us if it is not a data set that richly represents the community. And as Dr. Mendoza noted, we have a track record of knowing how to carry out and collect health data from hard to reach populations that we will be leaning on and stretching ourselves to build upon.
One last question too I have for you. Do you think this might be, I know coming up in June and through the summer months with the 2020 census, do you think it might be some type of collaboration or a piggyback on that type of, because you're gonna have people going door to door most likely on the census and might be able to pick up this data as well?
My super hope is that most folks have done what I have done, which is already filled out their census questionnaire and gotten it in. If they have not, we will absolutely look for opportunities to make sure that as we are advancing information about this, that we're advancing information about other activities like the census, like what food resources are available, so that we're helping to make this easier for the consumer.
Thank you.
Oh, Mayor, did you want to add something to that?
I was going to, but Wade took care of it, so.
Okay. Fantastic. Okay.
All right, thanks. Patty Singer from Minority Reporter, and then Mary McCombs from Spectrum.
Hi, to whoever's the best person for this. How is this working hand in glove with reopening? So what does the data need to show us before we can reopen segments of the community?
I'll take a stab at that one, Patty. So as I've said before, the data that we've been traditionally reporting, hospitalizations, cases even, really only tell us about what was happening 2 weeks ago. And our goal with this is to identify more what's happening today and yesterday. So, I would view looking at this in a couple of ways. One is really more as a way to know when we need to turn on the brakes. So if we start to see something blossoming in a particular part of the county, and we do some focused testing, we do some outreach, and we see some concerns there through contact tracing, that would be my indication to want to slow down potentially the process, or at least make the recommendation to slow down the process. I view it more as brakes rather than a gas pedal. But certainly you can see it in the other way. If things continue to be quiet with regard to the symptom tracker, and that correlates to what we're seeing in terms of new cases and hospitalizations and so forth, then it would be further impetus to say, well, we are ready. We are heeding the advice of maintaining physical distancing and all the other things that we've been talking about. So, I view it really in two different ways.
So what are the expectations of participation? Because if you find there are holes in where you're getting data from, then you're really not getting much of that indication, are you?
That's correct. And so that's why it's so important that we reach every corner of this community, because we certainly do not want to reach false conclusions based on incomplete data. And in many ways, that's where we are right now because of the way testing has been to date. We are unable to make very good conclusions about so many spots of our community because we haven't been able to gather those data. So I think today is an opportunity to right that wrong and find a way to get a better picture of what's going on here in Monroe County and our region.
And I would supplement that, Patty, by just saying that the experience that we gained and administering the regional health survey has really prepared the staff of Common Ground Health to be able to, on a weekly basis, track the responses that we're getting, find out where we are seeing gaps or weak spaces, and supplement the outreach that we're doing through you all today with micro media outreach and/or with direct outreach, so as to make sure that we are maintaining a robust and representative group in the data set.
Correct. I mean, this only works if we have a robust participation and volunteers from across the region, not even just in Monroe County. As we take regional approaches, I know you've just linked this, Patty, to what does this mean towards opening the economy and what that means when you're looking at a regional approach. We really do need participation from as many people as possible.
Okay. Mary McCombs from Spectrum and Kayla Green from WROC, you're next.
Hi, good afternoon. Thanks for taking our questions. And I appreciate what's being said regarding the survey. I think it's very admirable, but I guess I'm just trying to understand a little bit more about how we are going to reach every aspect of the community when we deal with our senior population, who of course are the most vulnerable. What sort of access might they have or not have to computers? So I'm just wondering how we're going to target that population, which again, most vulnerable for us here in the community.
Well, it's going to require us to work with all of our community partners, nonprofit organizations, community-based organizations, our government officials, our healthcare providers. It's going to take all of us working together and our partners in the media to reach as many people in this community as we can with that information on how to do it. But I also think that's why it's important that there's more than one way to sign up to be able to take the survey. If you do it through your computer with an email address. You could also do it, like I said, the step 2, I think in about a week, hopefully or so, we'll be able to add a texting option so you could do it through your phone as well. So we'll continue to look for other ways for people to access it, but it's also going to take a community effort with all of our partners in healthcare systems as well to be able to give people access to take the survey.
Can I just go off topic just a little bit? I have a question regarding, I don't know who would answer this, but talking about hospitals and the survival economically by staying in line with Governor Cuomo's criteria of 30% open. Can they survive economically with a 30% opening for potential COVID-19 patients?
Well, that's a very germane question. And, while we're trying to take care of patients with COVID, and fortunately with what the public's done with social distancing, with what the by obeying the mayor and our county executive and our governor about staying home and social distancing, we haven't seen the surge of COVID patients we thought. So the attention now is turned to non-COVID patients. We've seen people presenting later with stroke, with heart attacks and other things. And I believe right at this time, the risk of non-COVID illness in our community is greater than COVID illness. With that said, we are opening up because we have the surge capacity right now and the bed capacity to take care of illness that is sort of weighted. With our plans and with the way we've been able to collect PPE and prepare we have the capability now to not only have enough space for surging, but also take care of the population. We believe that we can get pretty close to how much we were doing before and still have the ability to surge up by planning for extra beds and planning with staffing in certain areas. So we believe we can do both. It's sort of like riding a unicycle and juggling at the same time, but we believe we have the skill and the staff to take care of a population of patients in our community.
Thank you.
Thank you, Mary. Kayla Green from WROC is next, followed by Patrick from WHEC.
Hi, everyone. So my question is about how we can ensure that the data isn't skewed. Is there a way to prevent people from entering multiple entries in one day, or is the email required? Would that prevent it? Is there any way to make sure of that?
Well, Kayla, you raise a good question, and there is a fair amount of faith in this. We are requesting that people tell the truth. And we hope that we can communicate that telling the truth is in everybody's best interest. We really don't have any way of policing this, and that's not our goal here. Our hope is that people will operate and do the right thing, again, because it's in theirs and everybody's best interest. But we don't have a way to prevent that. If you do leave your email address, you're not going to be able to fill out the survey more than once in a day. But again, this is really, more about faith and doing the right thing for one another than it is about policing and enforcing.
Okay. And then my second question is, you mentioned that some other areas have used this program, and I was just wondering, what were the sizes of those regions? What did this allow them to do? What kind of data or results have we seen from other areas?
So, the other areas that have done this are Stanford and Yale that I'm aware of, and they've taken a very different approach. Stanford's focused on the Bay Area. I think Yale is looking at a more national sample. We're all new at this, and I think to some degree we're all going to be discovering how this is useful together. But we do believe that there have been others that have gone before us, so we will learn from them as they discover new things. And to some degree, I think we're going to learn some things that are new that we can share with the rest of the country, to the extent that we are, to some degree, ahead of other parts of the country as well. So, this is a little bit of a new thing for all of us. That's why it's an innovation. But we believe it's really the right step forward so that we can better understand the prevalence of COVID infection as it goes forward in the weeks and months to come here in Monroe County.
Thank you.
Okay, our final question comes from Patrick Musikek from WHEC, and he'll have a follow-up.
Yes, good afternoon, everyone. My question is kind of similar to some of the questions that were asked, but I'll toss it out anyway. And Dr. Mendoza and Mr. Norwood, it's mostly directed to both of you. But obviously, you said that you're looking for people to take this survey on a daily basis. And realistically, people will take the test once, twice, maybe 3 times before stopping. How will that not skew the numbers, the data numbers that you're looking for?
Well, I guess I have a bit more of a glass half full view, Patrick. I think people are going to keep doing this. I hope that through the efforts from people like yourself in the media, from all of our partners here in the community, that we can convey that this is important to do going forward. Nobody wants to see our community fall victim any more than we already have to COVID-19. And to the extent that we can communicate that everybody's cooperation in on this, consistent, sustained cooperation in on this, will allow it to be valuable for us. That's really my hope. And so certainly you're right. If people did this for a couple of days and stopped doing it, it will not be useful. And that's certainly what we want to avoid. But we have too much on this COVID-19 pandemic to quit right now. And I think we've got to work together every corner of our community to make this useful and again, the weeks and months to come.
Patrick, and I would just amend and affirm what Dr. Mendoza has said. Those of you who know me know that I am a tactile person. I love to hug. I love to be hugged. I am waiting for the moment where we're no longer in this phase of recovery. But I need something to help me understand, as this disease, it is a novel coronavirus. We don't know a lot about it. We're discovering new things, and the CDC is providing new guidance on a daily basis of what are the symptomatic expressions. I need, and I am really appreciative of a tool that I can check in with each day that matches my morning prayer time, that says I'm okay and this is going to be a good day. I think that this is something that we're making available, not just to help the community, but to help all of our neighbors check in with wellness and know when they need to reach out to their medical care team. The better a job we do of communicating this, the more I think people are going to say, this is not only something I want to do, but I want to make sure my sisters, my mother, my children, and my friends are doing as well. And it will create a data set that will allow us to really understand all COVID-19 is doing is surfacing the patterns of health inequity that have existed, multiple chronic diseases in our community. And if we can provide better information to our public health and to all of our community about where those spots of ill health exist, we will all be able to go further, faster with regard to health improvement.
Thank you.
Patrick, did you have a follow-up?
No, that was it. Thank you.
Fantastic. Thank you very much. And I want to thank all the reporters and the media for being here today, and for all of you at home for watching and participating. And again, want to thank Mayor Warren for her leadership and partnership and collaboration as we serve our common constituents in the coronavirus pandemic. I want to thank Dr. Mendoza for his work and leadership of the Department of Public Health, and all of his staff and his team who are working so hard. And of course, Wade Norwood and your whole team at Common Ground Health for your help and partnership with this. And the University of Rochester Medical Center, Rochester Regional Health, and the leaders of our 8 sister counties in the Finger Lakes region who are taking on this important endeavor. I cannot stress how critical enough it is that we follow the advice that we heard to sign up and do this. We need to go to roccovid.org. Again, it's ROCCOVID.org, roccovid.org, and register today. You can do it right now. This is how we are going to stop COVID-19 in its tracks. This is how we will safely reopen, and as a community, stay open and keep ourselves open. There has been an incredible coming together of this community over the last several months. I am confident in the way that we have responded over the last several months as a community to fight this disease and keep our friends, family, neighbors, and coworkers safe and protected and healthy. And I'm confident in this community's participation in this program as well, because this is that next step when it comes to public health and giving our public health professionals the information necessary in order to keep us safe and understand more about the spread of our symptoms and this disease throughout our community. Thank you very much again. Thank you for your participation. And again, remember, rockcovid.org. Thank you.